go.
Hi, my name is Autumn and I'm going to be your student nurse today. Can you go ahead and tell me your name and date of birth? And are you in any pain right now? No? Okay. And are you allergic to anything? Any shellfish, latex, iodine, or anything? No? Okay. So after that, I'm going to make sure I have provided privacy for my patients. I have identified them and provided on the computer that I have the correct orders for this patient. Then I'm going to perform hand hygiene, and I'm going to explain the rationale of what we're doing today. Today we're going to be inserting a catheter for my patient, and I would assess for any need to do perineal care or cleaning of that area. I would answer any questions or provide any rationale that my patient might have, and then I'm going to obtain consent to perform this procedure on my patient. I have my bed raised to hip level, and I'm going to first begin by assessing my patient's abdomen for distension and observe the perineal area for any redness, any sores, any rashes, or any like breakdown of the skin. My patient is in supine position, and I have lowered the head back as low as comfortable for my patient. And then I'm going to obtain my catheter kit and perform hand hygiene once again. My kit's right over here. All right. So first we're going to open it away from the body, side, side, and down. And the 1-inch border surrounding my kit is now considered non-sterile. I'm going to try to keep my right hand sterile at all times throughout this procedure. Right. This pad is going to go under my patient's bottom to prevent soaking of the bed. Alright, I'm gonna get my sterile gloves out here, put them on. I'm gonna open them away and side to side as I would have done the kit. Discard of this. Okay. Alright, and again I've established that my right hand is going to be the sterile hand throughout the procedure. Alright. So this is going to go between my patient's legs. I'm going to open the antiseptic, squirt it onto my cotton balls. That's what I'm going to use to clean the perineal area. And then I'm going to move this between my patient's legs. This is going to go attached to the catheter. I would then attach it there. I'm not actually going to do that because I don't want to use this yet. So that would be attached, and I would remove the plastic piece to my catheter. The sterile lubricant would be placed in the corner of the box, and I would be soaking the tip of my catheter in that. Alright, so this is moved down between my patient's legs. And we're going to use one swab at a time, and we are going to only do one swipe per cotton ball. I'm going to use my non-dominant hand to spread the labia minora, and I'm going to continue to keep my hand in this position. Well, obviously at first you would let your patient know that you're going to be touching them in the first place and make sure you have their permission to be touching the sensitive area. But I'm going to be using this to spread the labia minora open, and I'm going to try to keep it there because if the flaps of the labia minora fold in, this is then considered non-sterile, and I would have to start over. So I'm going to clean along the folds. So I will use one side, discard of that guy, the other side, discard of that guy, and then down the center. And I can use the last cotton swabs if I would like to do it one more swipe through. So that is what you would do with these guys. Alright, and I would continue, I would not remove that hand in the technique. Keep it spread apart, and then I would lubricate, make sure my tip is lubricated and sterile. I'm going to have had it wound around my hand, and then I would insert it into the urethra, and I would insert it in until I saw urine, and then in a female I would insert it 1 to 2 more inches into the bladder. Alright, and then I would then release the labia after inflating the balloon. You would want to gently pull on it to make sure that it's in place, and it should not cause any pain or anything on your patient when you do that. The drain bag should be hanging on the side of the bed. And clipped on, and it should be lower than the bladder to make sure that it's all draining properly and there shouldn't be any kinks or anything in the tubing. I'm going to raise the side rail of my patient's bed, remove my gloves, discard of them, discard of any of my supplies or anything, and then I'm going to perform hand hygiene. They want to make sure that the catheter is taped or secure in place with the patient's thigh, and that way it doesn't get yanked on or pulled out when they're moving or repositioning. And then I would let my patient know that I would be back regularly to perform perineal care and prevent any infection that might try to occur in the catheter.